Hello, and thank you for joining our conversation about telehealth and child neurology. My name is Jessica Nickrand, and I'm a program manager at the Child Neurology Foundation. During the summer of 2020, as telehealth became more of a part of our community's lives, due in no small part to the COVID-19 pandemic, we surveyed caregivers and parents nationwide about their experiences so that providers, advocates, and caregivers alike could work together to make telehealth a good experience for all members of our community. Today, we are lucky to be joined by a provider and a caregiver who will help us to make sense of this data. Dr. Anup Patel is the neurology section chief at Nationwide Children's Hospital and the president-elect of CNF. He will be joined by Holly Paauwe, a parent to a young child with a rare neurologic disorder. Holly is also the creator of the HME Family Support Network and the HME Specialty Director at the Hemispherectomy Foundation. Thank you both so much for joining us today.
Thanks for having us.
Absolutely.
Thanks for having us, Jessica. Hi, Anup. Good to see your face.
Yeah, you too. Before we would have to do this in person, and so now we've got to do this twice on Zoom, and that's a nice little advantage. It's always good to see you too, Holly.
Yeah, I'm excited to talk about telehealth again. We did this a few months ago, and so I think now we've learned a little bit more from our families from the CNF survey, and I think it'll be nice to take a look at that data and see what maybe bore out from what we thought might be the case and what might be different, and to just chat about the positives and maybe even some of the remaining challenges.
Yeah, and I think also maybe to talk about our own experiences during this last
Absolutely.
6 months of the pandemic. And, I know specifically moving forward, it's going to give us an opportunity, you and I, to provide care for your daughter going forward using this model. And so I think there's a lot still that we're going to learn, but we have learned a lot. And you're right about that survey. And let's dive in.
Let's get it.
Yeah, so one of the things that surprised me about this slide where it talks about the number of telehealth visits was that, our patients that filled out this survey and caregivers that filled them out, they do have a lot of appointments, and then many of them had to be converted to telehealth, obviously, during the pandemic. Holly, is that something that you've had to do a lot with your daughter's care?
So interestingly enough, in terms of medical care, we primarily either delayed appointments a little bit and then came back into the office under really sort of strict protocols. But this is definitely something I'm seeing within the family communities that I'm involved in. And it's not a surprise, right? I don't think necessarily most of us that a lot of our kids with more, especially with more complex neurological conditions, that they have a multitude of specialists or therapists involved in care. And so, many of our kids may be getting weekly OT, PT, speech, things like that. And all of that obviously had to convert for so many of our kiddos quickly. I think, I'm not sure how all facilities operated, but I know ours here locally did make special provisions for certain children who were much more complex, where maybe things wouldn't translate in telehealth realm very well. Those kids still came in for appointments, again, under very reduced patient loads and very stringent protocols. But telehealth quickly became a big part of the medical world for so many of our kids that have a lot of care needs.
And I think the other thing I would comment is that, there are or have been barriers. I think in our own personal experience that we were not able to do telehealth because of the laws between Ohio and Indiana. And now that's been overcome. And so I think that potentially that'll open up the opportunities because, for us across state lines, now I can provide that care to you guys, which I think may increase these numbers. We'll see over time. I really don't know.
Right. Well, and I think that's one of the exciting outcomes, right? I mean, so much of this has a lot of negative connotations. A lot of this period of time has a lot of negative connotations and experiences, I think, in our lives and our minds. But I think in many ways, telehealth jumps really forward, maybe decades from where it would have been otherwise. And so thinking about the next time being able to see you virtually that wouldn't have happened otherwise. So I'm grateful for that aspect, at least. And it's something that we've talked, I remember my husband would often say, like, why can't we just Skype Dr. Patel today? We need to talk about these things. There's not really a need to lay hands on her. And so I think those appointments are the ones that really fit perfectly in telehealth. And so it's exciting to think about the potential in the future, even beyond COVID. Yeah, so I think, as I took a look at this slide and then the subsequent data, I think potentially in some of the data that we see, the fact that so many, a third of these visits were with new providers may influence some of those evaluations, some of those results, what people selected for the survey. And so I think that's maybe important just to keep in mind as we talk about some of the other data outcomes.
Yeah, I was surprised with how many of our respondents actually had a visit with a new provider. I mean, it just goes to show you what we talked about earlier, the complexity of the care that our kids need. And, that obviously meant that they were in this process of having to be seen by new providers, and I'm sure had to be shifted to the telehealth model. But yeah, I was surprised how many.
It would be interesting to see or have data at some point of who were these new providers, what specialties were they therapists? Just curious if more of any one specialty did more, saw more new patients in the virtual realm than others, because I would imagine that for some it would be hard to do a first time. I mean, I don't know. Are you aware of pediatricians that were taking new patients virtually? I mean, I guess they would probably have to, but.
Yeah, they did. And, I think, that's a rough way to potentially start that kind of relationship. So
for sure.
But we had to do new patients in neurology here at our institution as well. And, I think for some it worked well and some perhaps it didn't. I think, like you said, speaks to the perhaps, that because there's so many new providers that maybe they didn't feel as comfortable in that regard. And, as a provider, this is new, right? Like, so for us as medical providers, doing video telehealth has been a new experience, and perhaps for some was challenging. It's a different way to provide that care, and it's obviously out of our comfort zone that we're used to and trained under. And so I think that perhaps is one of the factors that hopefully will get better as we move forward and get more comfortable with this venue and the platform. And then our trainees are obviously having to learn under that new platform. So I feel like for them, they're going to be a lot more comfortable when they come out of residency and start their own practices, that they'll be more comfortable with this format. So we'll see.
Yeah, I agree with that. Working with the residency program here, certainly our residents are getting all kinds of training in the telehealth world. And I think, it's only going to serve them well. And then the patients and families that they see well too. So maybe another small benefit of this chaotic time. So wait times, I think this was a bit of data that really struck me. And I think is a really nice, positive outcome. It's certainly fairly pervasive. I think certainly in specialty care, that a lot of times there's just not enough providers, even in a big city. I live in Indianapolis and we still struggle with certain pediatric specialties having enough providers. So you might wait a good chunk of time to get an appointment. And I think what the average for neurology first visit was like 9 weeks. And so to see data that showed that 50% of respondents got a neurology appointment within 1 week, that's an impressive improvement that I think just, obviously impacts care in such a positive way. Did you guys see a change in how quickly you could get patients in?
Yeah, I will say that's probably one of the best benefits that we've seen in the pandemic as far as video telehealth goes is, we had significant access issues. Our volume of patients seen at our institution, we average like 16,000 patient visits in neurology a year at Nationwide Children's in Columbus. And, it was a struggle, like you mentioned, like 9 weeks, we try to get kids in within, 30 days. With telehealth, it just expanded. And what you saw on our graph of access was like hovering here. So our access that we like to talk about is the percentage of patients, seen within 30 days of their referral, new patients. And it was like this at 30%. And then boom, we're now at 80 to 90% because of the advantages that now we have. Because what happens in this situation, I think this data reflects it, is not only am I able to get new patients in via the video telehealth, but I will say the majority of the patients that we're seeing prefer in-person for their first new visit. But if I convert follow-ups to video telehealth, boy, guess what that does? It now allows me to see new patients, in person in clinic. And so it gives me that flexibility that I never have had. And that's true of a lot of my colleagues as well. And so we've actually seen a dramatic increase. And I agree with you, Holly, like this data definitely struck me. And it's something that I think we need to make sure resonates post-pandemic. Access remains a challenge in child neurology. And, we can only do so much, create more child neurologists, cure more diseases. But here's another way to help with that access issue. And geography is also potentially
huge
overcome here, right? Like you mentioned with you and John, like in the future now, you're right. You can just schedule a video telehealth with me and you're not going to have to, get in a car, drive 3.5 hours and whatever,
right.
get in a parking lot, park, all that stuff. So yeah, I think this is one of the biggest takeaways I had from this survey, and I'm really excited about it.
Yeah, me too. And I think if we extrapolate it even a little further, looking at this slide is really, I'm not sure that this parses out what type of appointment, but even this slide shows that essentially like 80% of the respondents for whatever appointment they were scheduling was within 2 weeks, right? And so, I mean, again, another impressive, I think, outcome from these appointments in particular. And I love what you said, because I think we can sometimes think just on the very surface, right? Improved wait times, but like you said, it actually allows you as a office to change workflows, right? So the fact that you can take some of those appointments and convert them to telehealth visits then gives you the opportunity to bring more people, higher priority face-to-face patients in. And so, yeah, the impact, I think, downstream is significant as well, and something to keep thinking about. And then on families, I think about what it's like to be worried and stressing over something going on with your child while you're waiting 6 weeks, 8 weeks, 9 weeks for an appointment, or worse, 3, 4, 5 months. And so to be able to have access to care much sooner and be able to have the conversations about your concerns has to just greatly impact quality of life and sort of, the mental health of families, I think.
I think on this slide, what I was really impressed about was that we were able to get respondents from a lot of different states and many different geographic regions. And that speaks to the data that says, it's inclusive. And so it's not just representative of one area. And then, I've done a lot of surveys and research purposes and different other avenues. And I think that's an important thing we always want to capture is like, did we get a wide variety and sample? And here we did. So I'm really impressed and happy about that. It speaks to obviously the engagement of our community as well, but also as the data is reflective of the United States and not just one area. So what I think is impressive about many of the questions we asked, whether it's related to, the child's behavior or ability to focus, or more importantly, the interactions with your child's provider, our caregivers pretty much felt the same, that in-person versus telehealth as it relates to that, which I think says a lot that, we're not decreasing the quality of care in many of these aspects as it relates to video telehealth. Same is good in that sense, right? Like we wouldn't expect it to be better, nor should it be, but we want it to be equivalent. As we provide that high quality of care, we want to make sure that's there in both venues. Holly, have you heard those experiences from others in the community or in your support group and advocacy?
At first, I was slightly surprised, and then I stepped back and I was like, but why should I? Why should I be? Because there's, I think, a lot of individuality in our families and our children, and so why would the assumption be that a telehealth visit would necessarily go better for my child from a behavioral aspect? I can think of a lot of reasons why that wouldn't be the case. So I agree with you, Anup, that ultimately, right, our hope and desire is that telehealth is as good as, mostly overall, right, as an in-person visit. And I think these results bear that out and would match what I'm hearing from our family communities and even in what some of the providers I work with have reflected back as well. I think there's a lot of, there's the individuality of the child that play in this, the families themselves, their comfort level. And as we already kind of touched on, this is new to everybody, providers alike, and sort of even their comfort level doing things virtually. So I think it's a win if we see that telehealth is rated overall on many of these data points as good as in-person visits. I think that's a very positive outcome for our community.
Yeah, and I think from a provider standpoint, if you look at the slide about interactions, it's such an important part of me and my colleagues, right? Like we want to make sure that is of equal quality, right? Like I want to make sure I can, connect with you virtually as a parent and a caregiver as I would if you were in person. That is like such an important aspect of, I think, neurology care and what we offer as child neurologists. So I was really happy to be able to see that it was the same in both venues.
Yeah, and I would agree. And I think as a parent, that is maybe one of the things that approaching and coming into telehealth was maybe a worry. Like, am I going to be able to connect in the same way with my provider and interact in a as meaningful a way? And so seeing that that's the case is encouraging.
Yeah, I'd like to share a personal experience from my own telehealth visits. One of the nice things that I take away, which I think maybe contributes to the meaningful interactions, is I love being able to see the caregivers and my patients in their home setting. I'll give you a quick story. I have this teenager with epilepsy and intellectual disability. It's mild, but he and I, maybe haven't connected as well as I would like in person, just because he's a teenager and perhaps, it's just the style. But he, in his video telehealth visit, we connected greatly because he's a huge fan of Legos and was able to show me his Lego collection, which we would have never been able to do. And it was such a warming experience, and you could just see it kind of shifted his demeanor. And I was able to then connect with him in a way that perhaps I haven't been in the past. And so it's one of the stories, positive stories, I'll take away from this experience. And it speaks to this slide, I think.
Yeah, I love this because I think for a couple of reasons. I'm a big believer in sort of the power of practicing kind of with a narrative medicine approach. And so, that every patient in front of you is the sum of their experiences, right? They have a story, and that caring for them and caring for them well means getting to know some of their story. And I think telehealth sort of gives you a view into part of their story, right? Getting to see people in their natural environment in a home in a less sort of contrived setting allows an opportunity to get to know them in a way that you would otherwise not maybe experience in a clinical setting. So another benefit there.
One thing that I, as a provider, have recognized as a limitation perhaps of video telehealth is the physical examination. And it looks like our respondents felt the same. I think that in neurology, it may not be as big of an issue. It is definitely more of an issue for new patients and certain neurological conditions that you're trying to evaluate, specifically, like focal weakness or, one side changes or, different things like that. In epilepsy, it's not as helpful at many times. I think you and I have commented that, Holly, that many times in our interactions, I don't necessarily have to lay hands on your daughter, where it's more of a conversation between me, you, and John, where we're just trying to get through some of these things that are going on in the lives and daily lives. But, one of the things that struck me about the comments as it relates to this slide was, yeah, for some, it's not helpful. For example, if you're a specialty that has or relies on, listening with a stethoscope, for example, that then is a limitation of telehealth currently. And I think somebody can potentially invent a way to do that or something. But also looking in someone's ears for ENT, you saw that one of the biggest areas where our patients went to was ear, nose, and throat. Well, they rely on scopes and different things. And so I think that this is a reflection of some of the limitations. And so you mentioned this best. It's an individualized situation. In some situations, even within that same patient, video telehealth may be the way to go. And in other cases, it may not be. And so it looks like our respondents felt the exact same way.
Yeah, and I would say even in, some of their free responses really reflect this too. There was a few comments about really the need for a mix, right? Which makes sense when I think about the various specialty care that my daughter receives. There are definitely times that this appointment probably needs to be in person, but then the follow-up appointment could really be done virtually. We just need to talk about how did that med change, impact her? How are things working from a GI perspective? We don't necessarily need to put hands on her multiple times a year. So I think that's an important thing to take away and consider and continue to push for moving forward, is that not even maybe in every specialty does every appointment need to be in person, but there are times in certain scenarios in which that can be converted to telehealth. The other thing I think that's reflected in here that we may have mentioned previously is some of the therapy appointments. Physical therapy, I think, is hard to translate to the virtual realm. I can imagine there's some things that families could do or be taught to do virtually at home, but so much of that is physical manipulation. And then the other piece, which I don't know if we talked about before either, is just, I know when my daughter's in PT, right, we have equipment. She uses certain equipment. That equipment I don't have in my home either. So it's also potentially an equipment issue for some of these appointments as well, especially the therapy.
Yeah, and specifically within, my domain of pediatric epilepsy, where we've seen the biggest advantage of in-person versus video telehealth, obviously, again, limitation of video telehealth is around neurostimulation devices. That's a big part of treatment-resistant epilepsy care. And, right now, the best way to do that is in person. I think there's an opportunity there, though, right? Like, I think, you bring up equipment triggered my thought on that. And I think, we should, as a healthcare system, start looking at opportunities to overcome some of those barriers, right? Like, is there a way where we could develop apps or some sort of other way where you could help us interrogate these neurostimulation devices as a caregiver? Or in the PT/OT world, are there out of the box thinking ways to achieve the same things without the necessary equipment? Or even look towards some of the virtual opportunities that you see in physical fitness, right? Like, the Peloton bikes or those kinds of things have a lot of virtual component to them now with some successes. So I think you bring up a great point, that something for us as a discipline to start focusing on for future opportunities.
Yeah. And I think it's a great way to look at these sort of things. And I think that's what I appreciate so much about Child Neurology Foundation, right? Where you identify challenges, it's easy, I think, to just stop there and name the challenge. I think any identified challenge is also an opportunity, right? It's an opportunity to like fill the gap, right? Or to change a process or to figure out how to do something better or differently in a way. And so I love that we've got people standing in these gaps looking for ways to fill them in, right? So the first part of that is understanding where those gaps are. And so I think surveys like this help us visualize what those gaps are a little better. So this one struck me a little bit because it feels like it's slightly more positive on the telehealth side. I don't know if you took that away, Anup. I mean, it's not a lot, but ever so slightly.
I think one of the things that resonates with this slide for me is ability to ask questions to your child's provider. There was a slight maybe uptick compared to some of the other questions we asked in regarding telehealth versus in person. Overall, the majority felt it was the same, which again, we talked about why that's important. But, perhaps maybe we thought, or some folks thought that, over 20 actually said that it was much better during telehealth. I think I agree. Some of the experiences I've had personally are, when I now do video telehealth and a patient with a lot of, either behavioral comorbidities or complex medical care needs, we do the exam at the beginning, get it out of the way, and then maybe a nurse or somebody who perhaps normally wouldn't be able to attend the in-person visit can, put occupy the child or care for the child. And then I've been able to have like a conversation I'm having with you that is just direct, face-to-face, one-on-one. And we are getting a lot accomplished. You're not as distracted, like looking over there or worrying about your child leaving the room or, a nurse knocking on the door or whatever. I mean, there are so many distractions in in-person visits that I don't think we appreciate on a day-to-day that now are taken away. You can just relax, have a good conversation. And, the other advantage I think is I've seen, at least in my own experiences, that caregivers are coming to the appointments in video telehealth with a list of questions more than I see in person. You know, one of the things you and I know, I've always encouraged is like, I love questions, you know, I love questions from caregivers. And so I'll ask, you know, put them down on a piece of paper. Well, that's hard to remember, right? Like, okay, I got to get my kid in the car. I got to go down the visit and I got to bring up this piece of paper, you know, where in the video telehealth, they're like, okay, the paper is right next to my, you know, video device. And so we've been able to go one by one by one and it's calm. I love it.
Yeah.
So I agree with you, Holly.
Yeah, and I think it struck me, even though, you know, on par, it's not a huge uptick, but it was slightly improved. And even in my mind, I thought how much more comfortable maybe families are asking questions in the comfort of their home and not being in person. Sometimes being in person, people can feel a little bit more intimidated, especially if they're asking a hard question, or maybe if they're asking a question that is around, maybe I'm maybe not agreeing in kind of the next step forward. And so sometimes in that virtual realm can make you a little more comfortable too. So I think there's a lot of particular things that can play into this, but it was, I think, an encouraging thing to see that families were certainly, you know, no less willing to ask their questions and maybe slightly more able and comfortable to do so.
So, you know, as relating to differences that we've seen in respondents and their answers, here's the one that strikes me on the benefit and the positive, right? This is overwhelming, where vast majority of respondents said it's much better during video telehealth. And I know we've talked a lot about that today, right? Like, it's just easier, you know, you don't have to, you know, drive a long distance or park in a parking lot and navigate through the healthcare system to get up and register. So, you know, it's more on their time as well, right? Because it's offered that flexibility that we talked about. And this slide definitely made me smile, because convenience is a huge part of quality of life and quality of care. And I think there's, you know, an opportunity here. And I know in our personal experience, Holly, you know, initially we weren't able to do video telehealth because of those state regulations. And so therefore it wasn't as convenient for you and John. And now, you know, I am able to do that. And so I'm excited moving forward. We're going to be able to add this to our, you know, care that we give. And it's going to hopefully be convenient or more convenient for you guys as a family. And, you know, that's important. That's
absolutely. Well, and I think, you know, I think there's obvious things, right? We always recognize the time aspect, right? So the travel time to and from, parking, things like that. But I think, you know, just using our example, it takes us about 3 hours to get to Nationwide to see you from where we are. 3 hours there, 3 hours back, the appointment time, you usually have to stop and get gas, right? We spend money on lunch or breakfast or something out because we're on the road. But it's also right, it's both of my husband and I typically go to that appointment together because it's such a, you know, a big part of our lives. We both want to be there. And so, you know, it's 2 work days lost for the most of us. And if it's during the school year, it's a school day miss for Avery. So, I mean, those things all compound. And I think, you know, this slide is really powerful, but it's even more powerful. You think about it in the aspect of going back to that initial slide we started on, right? That 5 or more providers, right? So if my child is seeing, say, 7 specialists and I'm getting this added convenience for all 7 of those, holy cow, like what an impact to quality of life. How much time do I get back to do like many of the things I need to be doing as a parent? Not only caring for my child, taking care of the rest of my family, home, and, you know, working and so many things. This is a really big deal. And I think, you know, we talked about in our initial video that this was going to be one of the positives. So not surprising, but I think it is a powerful visual to keeping telehealth moving forward.
Well, and you know, you're right. When we talked initially, we did believe this would be one of the benefits, and it's great to see data now that backs that up, right? You know, it's great when your assumptions come true in that regard. And so this one definitely resonated from that as well. So yeah, I had forgotten about that you and I did talk about that. And so it's great to have data now that backs it up.
And, you know, and one thing I would add too in this convenience piece is just the regional access, because I think that's important. It's part of the data, right? We know there are areas in the US where access to certain specialists is really hard to come by, and to have a visit, right, you might have to drive 5-6 hours to get the specialty care. So again, telehealth, opens the door for access in a lot of ways.
I think that's an important point in my domain of clinical care. I take care of obviously non-surgical treatment-resistant epilepsy patients. There's not many people that do that, right? And therefore, you're right. Like just even an access to a comprehensive level 4 epilepsy center.
Yes.
We as the medical providers, and it's an AAN epilepsy quality measure that's endorsed by the American Epilepsy Society as well, where we really do encourage treatment-resistant epilepsy patients be seen in a comprehensive epilepsy care center, so they have access to these other treatments and resources. Now I'm able to do that more than I have ever been. Getting kids from different states has been a real benefit. There are still some regulatory hurdles that we definitely need to work forward. Even post the pandemic, I want to make sure that we're able to continue those, care delivery opportunities. And, I think one of the biggest fears I hear, which I don't agree with, is, oh, you're going to rob, other places of patients. No, nobody here is in competition. We're just trying to do what's best for the children and their caregivers. And if it's me, great. If it's not me, great. And so if there's opportunities for you as a caregiver to get better care, then we need to help with that, right? Like
that has to be our goal as a community, right? Better care, not just any care, but better care.
And so, yeah, the more convenient we make it, the better we're able to overcome the barriers. Convenience and is part of it, but we weren't able to do this because of those barriers and regulatory issues and state-to-state insurance and billing and all this other stuff. And the pandemic just obviously pushed it forward so fast that we were able to overcome them. But you and I have highlighted that there is definitely opportunity, and I look towards the Child Neurology Foundation to guide us and to help advocate for our discipline and our caregivers and patients that listen, these regulatory hurdles need to stay down in a way and allow our providers and to give that care, and more importantly, our caregivers to seek that care. So, yeah,
I agree. I think that's the next wave, is to not let everything kind of pull back in, right? Which I think is a concern for some. That's feared.
Right. So one of the most surprising findings was this slide. After all the things that we just talked about, where most people felt, that care was equivalent and different aspects of care were equivalent, and then, it was more convenient. Many of the respondents said that they were very unlikely to want to do video telehealth again next time. And I think that does speak to perhaps the wide variety of care that was sought during the pandemic and was reflective in our data. Individualization, like you mentioned earlier, Holly, for some specialties and disciplines it works, some it doesn't. So I think that's possibly what this reflects, because it doesn't obviously mirror or match what we've seen before. But I don't know what you think, Holly.
Well, I was going to say too, I think, it's a reminder, right, that so many of those questions are they're very specific. It's one, was your child's behavior better? Did you feel like you could focus more, right? But whenever you get to this question, it's sort of the sum of all of it, right? So as a whole, would you do this again? And so I think for me, it brings up the potential or the possibility that for some families, they were weighing certain things, certain factors more strongly. So, I think we saw expressed that people did express, the lack of the sort of the physicality and the relationship from that physicality, and like being able to put hands on their child. And, as a parent, I can appreciate that even if I don't think there's something specific to put hands on and feel on my child, there is a comfort in having someone else's eyes on her in the real world, right? Because I think you look at your doctors to maybe pick up things or see something that you haven't even noticed or seen. So my thought is some of those things weighed more heavily when they were asked to kind of on whole say what they would do. Maybe they still like having the physical presence where possible, because they see that as a really high value piece of care for them. And it's enough to outweigh some of the other pros in their mind. I wonder though, and I hope that this slide presents to us, again, some opportunities. So if those are factors that are being weighed more heavily for some families, are there opportunities for us to improve those factors in some ways?
Well, and I think that if, I wonder if we would have asked, would you be open to a mixed model, like you mentioned earlier, where some of your visits were one in person versus telehealth, I think we may have gotten different responses.
I agree. And I think especially as you mentioned, or the type of care also, it would be interesting to see that in terms of having neurology pulled out. How do people feel differently about neurology care versus primary care versus, PT versus GI, ENT? I think we may see some variation in the data for the different specialties just because, of the things that they're treating and the requirements in that type of care.
Yeah, and I think, that was definitely reflective in the qualitative data that we achieved in the comments section. When you look at the comments as it relates to neurological care, I think people were overwhelmingly positive about that. But then the comments that I saw, was like, it was hard for my ENT because they couldn't look into my child's ears, or pulmonologists couldn't listen to lungs. And I think that goes to kind of picking up perhaps subtle things that, you as a caregiver can or don't, you don't have a stethoscope at home that listens to you and trained how to pick up a subtle heart murmur or whatever, and so I think that's what resonated in the comments for me is like, yeah, if we teased out as it relates to neurology, we would have seen different responses.
Yeah, I agree. And I also think this slide, I'm curious about over time. This was I think a 5-month sample, right? And so I wonder if you did the same sort of survey a year from now and people continue to have telehealth visits, would we see those numbers change just from a comfort level, right? As more people get used to it, providers get more used to it. I think that individuality plays in as well.
Well, maybe we should do that as the Child Neurology Foundation, to send out a follow-up, but we'll see. So Holly, we've had a great conversation today about the different aspects of the survey, but what's your overall takeaway from what you saw as it relates to this data?
Yeah, I think my overall takeaway is that by and large, right, people felt like they had mostly equivalent care. In some areas, it was a little more, maybe an uptake a little bit more positive. And then, we have the surprise slide at the end, but I think overall things are really demonstrating that telehealth works well in some cases, can work well, maybe with some improvement in other cases. And I really keyed on something that you mentioned earlier as well. I think when you were telling one of your patient stories about how wonderful it was for you, a wonderful experience for you to get to see, him in building with Legos and to get to know that piece of him. And so, I think a lot about within the medical community, so many demands and so many demands on time. We hear a lot about physician burnout and stuff. And so I love that aspect for improving sort of joy and the feeling of vitality and care when you feel like you can connect with your patients in new and exciting ways, that has an impact, a big ripple effect, I think, on the medical community and ultimately care at large. So, and then I think if parents feel that back on the other side, there's, that has a big ripple effect too. Strong, effective relationships are really important to high quality care for our kids and families. And so I think telehealth provides an opportunity for that in ways that not always as easily achieved in the clinical setting.
Yeah, and I think, I agree with all your points. And my takeaway in addition would be, the improvement in access. I think that as a discipline, we do struggle there, and being able to, just add another opportunity to provide care to patients with neurological illness is, important. And it's not going to replace in-person care. Telehealth is, it shouldn't, I think, but it should continue, and it should be an opportunity when it's needed to do, care in a different way. And I think that's what our respondents felt. And so I'm really grateful for them taking the time to fill out the questions, and then for us to be able to reflect on the data. This has been fun. Thanks.
It's been fun, and it's exciting. I can't wait to see what work comes next.
And what opportunities and improvements that we can make moving forward. And so I know the Child Neurology Foundation will be primed and ready, and we will lead that charge for our patients, caregivers, and those with neurological illness. So yeah, it's going to be fun.
And thanks, like you said, thanks to all the patients and caregivers, families who took the time to complete the survey. I know it takes time, but the data you provided was invaluable, and certainly helps people plan how to move forward better.
Thank you.
Well, and thank you to you both. That will conclude today's discussion. And on behalf of CNF, I want to thank both Drs. Patel and Holly for their expertise, their time, and their stories. You can find resources on telehealth and other issues for you and your family as we together work to navigate the new normal at childneurologyfoundation.org/COVID-19. Thanks for joining us today.